Road Trippin', brought to you by Beaumont Emergency Center.
We're road tripping today in Nederland. We're here at Mid-Jefferson Extended Care Hospital with this Mark Rice, and it's kind of in the name when you say extended care. But what is it you do here? What is the niche you fill?
Hi, Tom. Sure. Mid-Jefferson Hospital is a specialty hospital. The hospital specializes in taking care of patients who require extended acute care hospitalization. So in a typical case, a patient would have suffered a major illness or injury. They would go to an acute care hospital where they would stay maybe a week or so. And if they require prolonged hospitalization, they'll come to our facility where they'll spend on average 4 weeks, 5 weeks.
These days we think of surgeries and things like that where they try to be less invasive, less time in the hospital. But there are cases where someone needs a longer stay than a night or two in a hospital, and that's where you come in.
Right. There's actually quite a few of those cases, and we refer to it as a subset of all patients who go through a major acute care hospital. But there are patients who have wounds, who have major pulmonary issues, whether they're chronic or acute, or bad infections or serious infections that may be local or systemic. And those patients need acute care hospitalization for more than a week or two, and in most cases, on average, about 4 weeks.
I would think, again, referring to the name Mid-Jefferson, you're right here in the middle of Jefferson County, that the location, being in the center of the major population areas, is an advantage both to you and also to the people who come here and the family.
Right. Well, we're right down the road from some of the major medical centers here, and that's a plus because it makes it convenient for the physicians. But equally important, it needs to be convenient for families because families play an important role in a patient's recovery. The support from a family has got to be convenient for the families to come and visit, especially since their loved one's going to be here for as long as 4 weeks. So family involvement and location is important. And we are in central Mid-County, which is very beneficial. So
I would make the assumption that you encourage family visitation and that's part of your mission.
We do. Our whole approach is interdisciplinary with the physician as the leader. We have a very aggressive approach to case management. Case management tries to involve the family and the patient as much as possible, and the patient's care plan and the patient's outcome.
So when someone has to make that decision, either for themselves or family members making those decisions, what would you say to them about coming to this hospital?
Well, come here because we're going to give you every opportunity to get well. We're going to do it collaboratively with your physician leading the team. And we want your own participation as a patient along with your loved ones or your family. We want you to have the best outcome. And when you leave Mid-Jefferson, we want you to have the best possible quality of life. So in many cases, that involves family support.
All right, Mark, thanks a lot. Thanks for having us today.
Thank you, Tom.
Okay, road tripping here in Nederland, Mid-Jefferson Extended Care Hospital. If you have to make those decisions, you certainly want to make sure you consider this hospital for your medical needs.